Hello everyone. Today we will be discussing about the topic classification of diabetes mellitus for the essay series in general medicine for MBBS students. So how do we classify diabetes mellitus? See, when you take up diabetes mellitus, the most common denominator for all types of diabetes mellitus is hyperglycemia. So hyperglycemia is defining as the common feature of all types of diabetes, but the etiology, underlying pathogenic mechanism, natural history, even the treatment for different types of diabetes varies. So how do we classify these things to guide clinical decisions, to stimulate research into etiology, and also to provide basis for epidemiological studies? The WHO classification of diabetes mellitus classifies into type 1 diabetes mellitus, type 2 diabetes mellitus, then hybrid forms of diabetes mellitus. In this hybrid form of diabetes mellitus, one is slow growing immune mediated diabetes mellitus of adults, the other one is ketosis prone type 2 diabetes mellitus. Then there are other types of diabetes mellitus like monogenic diabetes mellitus, where there will be monogenic defects of beta cell function, monogenic defect in insulin action, then diseases of the exocrine pancreas, endocrine disorders, drug or chemical induced infections, uncommon specific forms of immune mediated diabetes mellitus, other genetic syndromes associated with diabetes. Then there is unclassified diabetes. This category should be used temporarily when there is not a clear diagnostic criteria, especially close to the diagnosis of diabetes mellitus. In April 2025, the WHO classified into another type called type 5 diabetes mellitus, which is malnourishment associated diabetes mellitus. So this is an updated classification. Then hyperglycemia first detected during pregnancy, then diabetes mellitus in pregnancy, or gestational diabetes mellitus, depending upon the timing of diabetes mellitus. So these are all the broad classifications of diabetes mellitus. Now we will go into one by one form. So coming to the monogenic diabetes mellitus, so we will be discussing detailed regarding these things in the subsequent slides, which might not be very necessary, but it is good to know these things. Monogenic diabetes mellitus. So MODY type 1, the genetic defect is in HNF4A, and then MODY 2, GCK, MODY 3, MODY 5, neonatal diabetes mellitus, and mitochondrial diabetes mellitus. Then drug-induced diabetes mellitus. So the common agents include glucocorticoids, thiazide diuretics, atypical antipsychotics, protease inhibitors, calcineurin inhibitors, pentamidine, then interferon alpha. Coming to the immune-mediated form, slowly evolving immune-mediated diabetes mellitus. Example, LADA. Then type B insulin resistance diabetes mellitus, then autoimmune insulin syndrome. Then coming to the genetic syndromes, Down syndrome, Turner syndrome, Klinefelter syndrome, Wolfram syndrome, Prader-Willi syndrome, then Friedreich's ataxia. Miscellaneous causes like pancreatic diseases, wherein chronic pancreatitis, cystic fibrosis, or pancreatic neoplasms. Then endocrinopathies like Cushing syndrome, acromegaly, pheochromocytoma, or hyperthyroidism. Infections like congenital rubella or cytomegalovirus, then post-surgical states like pancreatomy. So these are also the cases wherein diabetes can occur. Thank you for watching. I hope you have learned from this video.